It was the first week of preseason practice for the Lehigh women's basketball team, more than a month before their first game.
We were just doing a one-on-one drill. I was dribbling from the right side of the basket with my left hand, and I was turning to pivot and shoot, and as soon as I planted my right foot, my knee just gave out.
I felt for her because she had worked so hard this summer and, you know, in our preseason, but my thought was not, oh, you know what I mean, I'm next.
In fact, Haley would suffer the same fate as her teammate, a torn ACL just minutes later.
Her step back jumper is her patented move that she probably shoots that shot 50 times a day at least, and you know, it was just in a warm-up drill. She stepped back and just planted when she stepped back on it and fell to the ground.
I don't really have a lot of recollection of like going from making a move to not making the move anymore, but the moment I did it, I knew what I did.
That was the end of practice for the Mountain Hawks, but deja vu for head coach Sue Troyan, whose players have now suffered 6 ACL tears over the last 3 seasons.
The numbers vary from year to year, but women are much more likely to tear their ACLs than males. And there's a lot of theories. We don't have pure facts why this happens, but there's a lot of theories. One of it is just the way the bodies are set up. The hips are a little bit wider with females as their male counterparts, which starts their hips out a little bit wider, and then it comes in at a sharper angle. It's called the Q angle, how steep your knees come in. And so that puts a little bit more stress on your ACL.
Dr. Daniel Terpstra is an orthopedic surgeon for Coordinated Health and explains the main function of the ACL, or anterior cruciate ligament, is to stabilize the knee.
The ACL comes at an angle like this, and it also comes from the back to the front. So normally your knee is supposed to do this. Without the ligament, you can shift forward and you can pivot. It's giving you an unstable knee. Not
ideal for cutting, pivoting, and planting in basketball. Anne-Marie and Haley were both forced to undergo reconstructive surgery performed by Dr. Terpstra 2 months apart, the start of their 6 to 9 month recovery process.
The rehab for an ACL is really twofold. You have timelines based on scientific studies we do that patients aren't ready to go to the next phase until you get to a certain time in the healing process. And then there's the individual rehab timeline, which, depending on the efforts in the body of the individual athlete, how quickly you can progress them. So you can't go from phase 1 to phase 2 without first hitting your mile marks, and 2, letting that time lapse.
That's better.
I'm at the end right now of the jumping phase, so they start with 2-foot jumping and then single leg jumping, and then at the end of this week they're going to allow me to jog again, and then I'm starting agilities, so you do like 75% speed, and then they allow you to work up to full speed.
Right now I'm doing step-ups and squats with just light weights, and it's interesting to see how your leg shuts down the muscle right after surgery. But I've talked to so many people who have gone through the same thing, and all they've told me is that they've come back stronger.
That has been evident to the longtime Lehigh head coach, who says the injury is much less devastating than a decade ago.
Early in my career here, when somebody did the ACL, it literally looked at it almost like a 2-year injury. So it was a year of rehab, and then it was a year of coming back from that rehab. What I've seen over the last 5-7 years is that kids are actually stronger when they come back from the injury than they were 10 years ago, and they're actually better athletes, more well-trained, so it doesn't happen again generally. And I think again, the resilience that you learn through going through that process actually helps them as an athlete.
Rehab is ongoing for both current Mountain Hawks, who each say they're pushing each other and are ahead of schedule, crediting the partnership with Coordinated Health and Lehigh Sports Medicine.
One of the people that I've worked closest with is Rachel on our sports medicine staff, and she's super positive, but also like expects the best from me, and so she'll tell me when I'm doing really, really well, but then also isn't afraid to be like, nope, I need you to a little bit more knee bend, a little bit more of this.
It's easier for me working with the Lehigh athletes just because of the constant communication I have with the training staff and the coaches. So that relationship really helps to know the athletes on a more personal level, what the expectations are, and to tailor a program for them.
I think all those relationships are really, really important for an athlete to be successful. And I know our athletes come out of those surgeries, and because of the relationships with the doctors, the training staff here, our athletic training staff as well here, that there's a lot of different people that are really working hard for the athletes.
Now, across the country, there are an estimated 150,000 ACL injuries per year. Dr. Terpstra tells us he performs up to 2 to 3 surgeries a week. So as an athlete, can you avoid the injury, or can it happen to anyone?
There's people that are less predisposed to it. The better muscular control you have, the better shape you are. If you play a sport that doesn't involve a lot of cutting and pivoting, you're less likely to have an ACL, but it can happen to anyone.
While being sidelined wasn't part of the plan, Haley and Anne-Marie are focusing on the positives and can see the light at the end of the tunnel.
At first I was really upset because I was like, all that work I put in, I gained all that muscle and I lost all that muscle, but now that I'm starting to walk and I'm starting to lift weights again, I'm like, wow, like I really can just make the best of this and come back stronger than ever.
It makes you stronger on the back end, mentally, physically, all those things, and I really feel like I've developed a greater appreciation for some of the little things that I took totally for granted before I got hurt. I love playing basketball, and I love this team, and I can't wait to just be out there and just be a part again of the on-the-court stuff, and being able to push my teammates more than just verbally, and being able to be out there with them.
1, 2, 3, together.